for checking in with us today. We are in part 4. Hopefully you enjoyed the full video about vaginoplasty. But we have to spend just a few moments on recovery and risk. I generally encourage patients to take off at least 7 days of work. 10 days would be wonderful, but at least 7. Well, what is it like in the immediate post-op? The best description that I can think of is a bowling ball is in your rectum and you want to pass it and you can't. But invariably by 3 days, you will have a bowel movement. A lot of that pressure and pelvic pressure that you're experiencing will go away. We do have a medicine regimen that is tailored for this type of pain, which also makes it much more manageable. So I have a lot of gym rats and oftentimes are wondering what can I do at the gym and when can I do it? So at about 2 weeks after recovery, you can do upper body. At 4 weeks, you can enjoy some cardio, but please, no kettlebells, lunges, squats until 8 weeks because these types of exercises put a lot of pressure on the pelvic floor, which we have operated on. In regards to sex, what are we going to do with sex? For the first week, I want you and your partner to act like you don't even know each other. At 3 weeks, you can have oral sex performed on you, or if you would like, you can self-pleasure externally at 3 weeks, but no penetrative intercourse for about 8 weeks. It could be a little sooner, but generally think that you're not going to have intercourse for at least 8 weeks. Lastly, you will have vaginal bleeding. You understand it's not might or maybe, you will, but the time and amount will vary from person to person, and it can be anywhere from 3 days to as long as 3 weeks, but this bleeding will be very light, pinkish in nature, and most likely consistent with the tail end of a menstrual cycle. All right, lastly, we're going to talk about risk. There's 5 key risks. These by far are not the only risk, but they're the most common 5 risks that we are concerned about. Number 1 is infection. In general, you usually will be prescribed antibiotics starting a couple days before, day of the procedure, and a day after the procedure. Another risk is healing difficulties. I mean, we're human beings. You can slip, you could fall, you could have a nightmare and roll over and do something in the bed that puts undue stress on your incision lines, making healing a little bit more difficult. Delayed bleeding. I mean, we talked about that you will bleed anywhere from 3 days to 3 weeks, but I'm talking about heavy bleeding like a faucet starting maybe day 2 or 3 after the procedure. You could even develop hematoma formation, which is a collection of blood underneath the skin that would need to be removed. Another risk is, Dr. Reed, I'm tighter, but I'm not as tight as I had hoped. Or you could be over-tightened. Of the two, most people would rather be over-tightened than under-tightened because people understand the vagina does stretch. Last risk, which is probably the least likely to occur and almost never does, but it is in the literature, is possible inadvertent entry into the rectum with the possibility of fistula formation. Fistula formation is basically a communication between the rectum and the vagina. That means the vagina could see liquid stool or even pass gas through the vagina. If this were to occur, though it rarely ever does, it would have to be repaired by a colorectal surgeon sometime in the future. So, I hope you enjoyed our 4-part series. We'll have other things coming your way. I hope you learned something about vaginal laxity, the biomechanics of sex, as well as just understanding vaginoplasty, its recovery and risk. Thanks for tuning in.